96.3 FM, The Source.
All right, 25 minutes before 11 o'clock. They say jealousy is not a very flattering emotion to have, right?
Oh, it's absolutely the truth.
But I'm going to tell you, when I see somebody with a great smile, I get jealous. I do, Robin.
Well, that's healthy jealousy.
Is it?
Yeah.
See, when I look at old pictures of myself, it was pretty good. I had a pretty good smile.
Yeah.
So we have somebody on the phone, Dr. Ami Barakat. He's an award-winning general dentist, trained in orthodontics. See, if I had a better smile, I could speak correctly. He's written a book about this. It's called Perfecting Smiles, Changing Lives. And I truly believe that's probably true. Your guide to an exceptional dental experience. Oh my gosh, Dr. Barakat, I love this topic because you know what? I'm jealous of people's great smiles. Good morning, doctor. How are you?
I'm great. How are you doing?
Good. Where are you?
Currently, I'm in Ottawa, Ontario, Canada.
So you've been doing this for a long time?
I have, yes.
Okay, and I don't mean to ask that in kind of a weird way, I guess, but I was just wondering, have you seen changes in, oh gosh, not just the natural teeth, but also the ones that replace or cap the real teeth?
Changes in what? In technology?
Well, okay, let me put it this way. When I was a kid, my friend's father had to get false teeth. And it looked horrible. I mean, it looked like it looked like Halloween teeth. But
you knew they were false teeth, exactly.
Yes, and I don't see that anymore, so I'm thinking it must have changed.
Oh, yeah, there's so much that has changed, even in the time I've been a dentist, and every year we're learning new stuff, and I'm learning new stuff to just keep getting better and stay on top of things. So the materials are better, the technologies are better, our knowledge of the human body gets better every year, so things are getting better all over.
And when we say smiles, obviously that's the teeth in the front, but in my case, it's most of the teeth that are not in the front that are. You know what happened for me? The fillings that I had when I was a kid fell out over the course of the years, and I just have been neglectful about getting them fixed.
Well, that's not very good. Are you going to get them fixed?
Yeah, I am. Eventually, yeah.
We have been told that if a person's mouth isn't healthy, that they could cause pain or maybe even death in the individual.
Yeah, I don't necessarily like going that far when I'm talking to patients. That can be scary, but that's true. I mean, it's 2018, so people aren't usually dying from dental infections because we can get at them quicker. But if anyone was to let a dental infection go far enough, it can swell enough to block off an airway or even an abscess into the brain. So it can be very, very dangerous. But hopefully people get there a lot sooner before it ever gets to that point.
So talk about a couple of different groups, because we have an eclectic listening audience, and let me explain why. First of all, we have a university in our listening audience, so a lot of young smiles. And I'm hoping your information can help them keep those beautiful young smiles. And we also have a lot of retirees in this same listening audience, and they obviously have different dental concerns. So what would you say first of all to the younger group as far as keeping their smile? What do you tell them?
Honestly, it's just being intentional about it. If you're intentional about keeping your smile, you'll do it. So having good oral hygiene habits, that's just simply brushing a couple of times a day and flossing once a day. I mean, I know that's pretty redundant and we hear it, but people just simply forget to do it sometimes, and then all of a sudden, a year passes and you have cavities and fillings. And the problem is when you're young, if you have a filling, you're pretty much stuck with that for life, because that filling's gonna have a lifespan, and you're gonna have to get it replaced, and it's gonna get bigger, so that by the time you're 50 or 60 or 70, you're getting root canals and crowns on the same tooth. So the young people, that's the best time to prevent it. And of course, just regular checkups to the dentist to make sure if something does start, we can catch it early. I think that's the best advice I can give to anyone who's young and still has an opportunity to save a dentist from drilling into their teeth.
Well, you talk about children that have ADHD, how that might affect their teeth and their breathing.
When we talk about ADHD, it's a much bigger. It's actually a much bigger situation. Definitely, kids with ADHD have dental issues when it comes to just oral hygiene. It's just much harder for them to brush their own teeth and keep them clean, or even to get them to sit in a chair long enough for a checkup and a cleaning sometimes. However, in my book, when I'm referring to ADHD, it's more about the whole physiologic dentistry aspect, which there's a lot of children out there that have been diagnosed with ADHD and have all the symptoms of ADHD. But a lot of those kids have airway issues, which basically mean they can't breathe properly through their nose. And, and due to, although it sounds like it's not necessarily a huge deal, due to a whole cascade of events, ultimately the symptoms of sleep breathing disorder or obstructive sleep apnea in children, because you can't breathe through your nose, mimic those of ADHD. So a lot of these children who are on medications for ADHD that also are mouth breathers, we're possibly treating the wrong thing.
Oh, wow.
So that's actually a pretty big deal.
And what is the connection with dental work?
The connection with dental work is, it's not specifically like what we were talking about, fillings and so on. If we find dentists who are trained in this, and it's usually sleep dentists or physiologic dentists who have specialized extra training more than most dental schools offer, they're the ones that can identify these sleep breathing disorders. If you think about who in a child's life is looking in their mouth and around their face the most, it's usually a dentist, not a doctor. So these specially trained dentists are the ones who usually will be able to identify the signs of these sleep breathing disorders and almost be the quarterback, sending them to the proper physician or the proper ear, nose, throat specialist or allergist or whatever the case may be to get them the treatment they need to help hopefully eliminate the symptoms of ADHD, as well as, there's so many things that it can affect. A lot of kids these days have malocclusions, which basically means bad bites or teeth that are crooked, or their face is not developing as it should be. There's disproportions, and all of that is also because of mouth breathing. And it's usually these sleep dentists that can diagnose this.
Is that like a fix with braces? Does braces fix that?
The braces would fix that in the right hands for sure, but it'll fix the symptom and not the cause. So, for example, if I was actually just talking to a father about this today, if I straighten a child's teeth without addressing an underlying breathing issue, my fix will be very, very unstable because I haven't fixed what caused the issue to begin with. So I would always want to fix those teeth in conjunction with a medical doctor fixing the physiologic issue. Yeah.
And if we could squeeze in, I want to make sure we're fair to the book. So does the book answer a lot of the questions that we're most likely to ask?
The book is. Thanks for mentioning that. The book, the first chapter of the book goes straight into physiologic orthodontics. There's a lot about dental experience in there, but the entire second half of my book, I have divided into almost sections, and this also addresses your different demographics of your listening area. There's sections in there for each age of life, so from infants to toddlers to preteens to teens to adults to seniors, and what they can expect and things that they should be looking for at different ages. So it definitely does address that for them.
So the only other thing I think I wanted to ask, and this was somebody asked me to ask this, was about what do you call them, Robin? The snap-on teeth? What do you call
snap-on smiles? Yeah.
Yeah. What is that?
There's a company actually called Snap-on Smiles, although different companies do similar things. But basically what that is for people who can't, that's entirely different than what we're talking about, but it's cosmetic dentistry. If someone wants, let's say, a smile makeover, such as veneers or bonding, and either can't afford it because it can be thousands, if not tens of thousands of dollars, or they just want a preview to see how it will look, a dentist who's trained in this can actually make a snap-on smile. It's literally what it's called, where it's a flexible resin that you can just snap over your own teeth, So if your teeth are crooked or stained or too short or something that you don't like, when you put these teeth over top, it just sort of covers them, and you have this brand new smile that you can walk around with. And then at the end of the day, you take them out and put them bedside again, and you have your own teeth again while you're sleeping.
Wow.
Yeah, it's pretty cool.
I had no idea there was such a thing.
Yeah, that doesn't take care of the problem, though.
No, it doesn't take care of the problem. It's a good interim fix for people who are sort of thinking of treatment down the line. Definitely.
And can you eat with them in, or do you have to take them out when you eat?
You can eat with the Snap-on Smile Company and other ones. You definitely can eat with them in, for sure. However, you have to be careful because stuff can get in under them. So you want to go to a washroom where it's private, pop them out, clean them, clean your teeth, and pop them back. Or else the teeth under there can decay if you don't clean it properly.
Doctor, in 10 minutes, you gave us so much information. The book has a lot more. It's called Perfecting Smiles, Changing Lives. I found it on Amazon. Do you have a website you want to recommend?
Definitely. If anyone wants more information or you want to do an assessment for yourself or your children about physiologic dentistry, it's dramiBarakat.com. That's AMIBarakat.com.
Okay, very good.
If anyone wants to.
Doctor, thank you for taking time out of your day to do this.
Oh, thanks for having me, guys.
You're welcome.
It's been great.
We'll be right back.
There's a lot to love about Freddy's frozen custard and steak burgers.
I love the really little thin crispy fries.
Love Freddy's for the patty melts and the turtle sundaes.
It's gotta be the custards.
The California steak burger is my favorite.
It reminds me what burgers used to taste like when I was a kid.
I love Freddy's.
Stop in for Freddy's famous steak burgers, cooked to order and topped your favorite way, all on a butter toasted bun. Freddy's frozen custard and steak burgers, the taste that brings you back.
I'm Jan Marino, and it's my great honor to represent Palm Garden as the winner of the Best of the Best contest for rehab 2 years running. Woohoo! It's not easy to meet the needs of our guests, learn their life stories, and exceed expectations, but that's our goal every